Yes. Good evening, everybody. Thank you so much for joining us today. It is a pleasure having you all here today evening. I am happy and honored to present to you Dr. Erzsebet. She's going to talk about a wonderful subject and hope we all learn a lot and take back to our clinics. And I present to you Dr. Erzsebet and she can take over the mic. Thank you.
Okay. Thank you very much, Dr. Rashmika. Namaste and hello, everyone. Good afternoon for the people from Romania and India, and good morning to my dear friends from Brasilia, and hello, everyone from all over the world. So my topic for today is homeopathy and art therapy helping to overcome addictions. A few words about myself. I am Erzsebet turos. I am medical doctor and homeopath from Romania. I am specialist in family medicine. I have been trained in family therapy and I have a master's degree in psychological counseling and psychotherapy. I've worked more than 20 years in a psychiatric hospital for chronic mental ill patients. And in this hospital, I innovated the treatment through introducing occupational therapy and art therapy. For all of my work, I have been nominated for Nobel Peace Prize in 2005 in a project 1,000 Peace Women across the globe. Later, in 2011, I started to study homeopathy, first in Bucharest. After that, I followed the 2 years e-learning course with Professor George Vitulkas. And starting with 2016, I followed many online courses about repertory and mentoring on the Other Song Academy Mumbai. In 2018, I participated on a master course with Dr. Rajan Shankaran, and also in this year, I participated on my week with Rajan. I followed also many video lectures from Dr. Gaurang Gaikwad and the Homeopathic Hub. I hold many awareness workshops about homeopathy in Cluj. I participated with presentation about homeopathy on international conferences in Cluj. Other interests and studies which I studied astrology, psychosomatic medicine, New German medicine, gemotherapy, Schüssler salts, and Bach flower therapies. About my topic from today, I would like to speak a little bit about addiction. What is addiction? I would like to share with you a very useful tool, which is TRIPS2, which helps for the quick recognition of anxiety, depression, and alcohol disorders. I will speak a little bit about the homeopathic approach. I will show to you a few rubrics related to different addictions from different repertories. I will present 2 cases to illustrate what I have speak about. And finally, I will speak a little bit about the benefits of art therapy and different techniques of art therapy. So, what is addiction? I would like to give a very short definition. I would say that addiction means an uncontrollable urge or compulsion to engage in some specific activity despite being aware of the negative or harmful consequences on one's physical and emotional health and relationships. And here we can speak about recreational drugs, alcohol, tobacco, gambling, sugar, caffeine, sex, food, work, or even dependent relationships. And now I will try to present you this tool, which I spoke about, that it is very useful to identify exactly the patient problem. This is the TRIPS2, which means the Training for Interactive Psychiatric Screening, which was elaborated by Professor Heinz Kachnig. Professor Kachnig is a professor of psychiatry on the Medical University of Vienna. He was director of Ludwig Boltzmann Institute for Social Psychiatry from Vienna, Austria. And in 2009, he elaborated this tool, these TRIPS. And I was lucky enough, I was between the few Romanian doctors who were trained directly by Professor Kachnik about this tool. This is exactly an interview for use in non-psychiatric settings for the quick recognition of anxiety disorders, depression, and alcohol disorders. And why is this important? Because as Professor Kachnik said that there are many more cases, many more people who are facing this problem of anxiety, depression, and problems related to alcohol use. And unfortunately, not all of them can get to the psychiatrist. One part because maybe there are not enough psychiatrists regarding that how many cases are worldwide which are dealing with anxiety, depression, and alcohol-related problems. And the other part is that, as we know, to go to psychiatrist, even in today, it is like a stigma. So many of the patients who are dealing with this problem, first, they address only to their family physicians. And that is why Professor Kachnik trained us, a few people, and we had as a task to train other family physicians too about this tool. And why is this important? Because okay, for us as homeopath, maybe it would not be very important to have the exact diagnostic, but the things are so that these kind of people who have, for example, problems related to alcohol, they are not coming to us as homeopaths directly because of their addiction. You can find about their addiction only if you take the case deep enough. Because at first, they are coming for different physical symptoms, maybe. And during the case taking, you may find out that they used to drink alcohol too. And it is happening like this, that they will say to you that occasionally they used to drink alcohol. But if you put a question, okay, how frequently does it happen? You will find out that this is happening daily. And you will ask about, and what about the quantity? They used to say to you that, oh, just a little bit. But what is exactly this little bit? So these strips can help us, first of all, to identify in which category belong the patient's problem, because we can diagnose or recognize with this tool three situations. The first is the excessive alcohol use, which is not an ICD diagnosis, is only a screening category. But this is important because here we can speak about excessive alcohol use if a man consumes more than 21 units of alcohol per week, or for women, it is more than 14 alcohol units per week. The next one is the harmful alcohol use, which is already a diagnostic from the International Classification of the Disease. The code is F101. And here we have physical or psychological harm due to excessive alcohol use. And the third one is the alcohol dependence, which is another ICD diagnostic. And here we have already withdrawal symptoms. So here we have a few questions which help us to make the right diagnostic. And here in the next, you can see the patient questionnaire for TRIPS 2. As you can see, the questionnaire is quite short, not too long. And another thing which is very important, that on the same page we have the questions for depression, for anxiety, and for the alcohol use. And why is this important? Because in most of the cases, the patients who have problem related to alcohol, they can have, and usually they really have also symptoms related to depression or to anxiety. And as I said, so we can identify if the patient belong only or dealing with this excessive alcohol consumption, which means that in men, he used to drink more than 21 unit alcohol per week, or in women more than 14 unit alcohol per week. But this is only a screening category, or we can speak about harmful use of alcohol or even alcohol dependence syndrome. What does it mean, an alcohol unit? An alcohol unit is a 330 milliliter beer, or 250 milliliter wine, or 20 milliliter brandy. And now, I would like, in a nutshell, to speak about the motivation for addictive behavior. The addictive behavior mainly has two motivations, or the desire for sensory pleasure, and the avoidance of pain and suffering. But deep down, the roots of the addictions are somehow more complicated, because it can be like an unfulfilled need for love and acceptance, a loneliness or sensation of isolation, culpability. There can be an inner anguish or misunderstanding. Or we can speak here about family abandonment or unhappiness with themselves, feeling useless, inadequate, inferior, or incapable to act for themselves and the others. And I would like to say that the reason why homeopathy can be effective, can help effective these people, is exactly this, that we, in finding the right remedy, we usually have to take in consideration these roots of the addiction. So now in the next, I would like to present you a study which was published in 2006 by Franz Küsse. It is a study about addictions, the homeopathic treatment of. It took place in North Holland, and in May 1998, the homeopathy has been part of the treatment in a regular clinic for addiction. In this study, there were 159 clients who have been treated with homeopathy since 1998, and the results were in the same order, that about 70 reacted well, and they were in a much better emotional and physical state and were clean when they left the clinic. So the conclusion of this study was that the combination of being aware of the underlying problem through consciousness and stimulus to the vital force through homeopathic remedy enforce each other and can really give permanent cure physically, emotionally, and mentally. Insight alone can sometimes bring real change, but in practice, it is seldom strong enough to take away the patterns of addiction. So now a few words about the homeopathic approach. Homeopathy is based, have some basic principle written by Hahnemann, and maybe the two most important basic principles of the homeopathy are the individualization, which means that we treat the person, not the disease, and the other one is the holism, which means that we take in consideration the totality of the symptoms on mental, emotional, and physical level, but also the causality and the life circumstances. So the homeopathic anamnesis is an exploratory about the mental emotional symptoms of the patient, including the dreams, delusions, and fears, about his behavior, and here we use the observational facts and heteroanamnestic data, about the exciting factors. Here we have the childhood traumas, the dynamics of family relationships and the relationships at work, and of course also the pathology regarding the affected organs, the local symptoms, the physical generals, and modalities. And of course, according to Hahnemann, it is very important to this individualized examination of a case of disease. as Hahnemann had written in Organon. So for this, we as homeopath should be free from prejudice. We have to have sound senses, to be attentive in observing, and it is also important that fidelity in tracing the picture of the disease. And now I would like to. Sorry, is there a problem that somebody is written that cannot see or listen? Okay, I don't know. So now in the next, I would like to present you Dr. Rashmika.
No. I'm sorry. No, it's okay. Don't get carried away with it. We will. Anyone who cannot see or listen, please refresh your browsers so that it will not be disturbing for the presenter to
Okay.
continue with her presentation. Thank you
Okay.
so much, and sorry for disturbing.
Thank you. So I would like to present a few rubrics from different repertories related to alcohol consumption. At first, I would like to present rubrics from the Synthesis 9 repertory from Radar 10 from Friedrich Schroens. As you can see, we have many remedies, like 149 related to alcoholism, but which is even most interesting, we have many specific rubrics like alcoholism drinking on the sly, and there are two remedies, or alcoholism from excitement, or alcoholism after grief, and this is a single remedy rubric, or alcoholism before menses, or another one very interesting, alcoholism during or after pregnancy, alcoholism from timidity, or this one, alcoholism with complaints of upper limbs. This is a rubric which I used in one of my case. Or we also have rubric to support the withdrawal from alcoholism. As you can see here, there are 14 remedies. Or we have also a lot of remedies, like 91 related to the delirium tremens, or the sleeplessness in drunkards. And we have also the rubric related to history of a family history of alcoholism. We also have in this repertory rubrics related to addiction, tobacco addiction. So like tobacco, nicotinism, or desire for tobacco. We have also rubric related to desire for psychotropic drugs, or rubrics related to bulimia, or ailments from sexual excesses. From Clark repertory, we can find these interesting rubrics that which are the temperaments who are addicted to different things, like persons addicted to coffee is typical for nux vomica, or temperaments addicted to liquors, spiritus, is we can find in Lacaze's nux vomica or opium. Or if we take a look in the reliable repertory from the Synergy homeopathic software, there we can find even more rubrics and much more remedies. And there are very interesting rubrics, like, for example, the single remedy rubric that drug addiction in cancerous patients, and this we have in Aurum muriaticum natronatum. Or other very interesting rubrics, like persons addicted to use of coffee, wine, liquor, spices, and is typical for nux vomica. But I would like here to emphasize that in each and every case, it is very important to make the individualization and not just to take a single rubric when you prescribe a remedy. So as you can see from the reliable repertory, we have a lot of rubrics and remedies. From the Tarkas Kulkarni AIDS repertory, we also have this rubric that addictive personality, and we have 6 remedies like carcinosinum, lachesis, medorinum, nux vomica, opium, and tuya. And now I would like to present 2 cases. through which I will illustrate what I have said before, that these people, they were addicted to alcohol, but the peculiarity of the cases, if I can say so, was that they were coming to me because of some other reasons, but finally the right remedy helped her to heal from their addiction too. So the first case is a 52 years old man who was divorced, who visited me last year in July. His chief complaint was a stiffness of left shoulder. But his main complaint, if I can say so, was the inability to take a decision concerning his life. He was in a kind of midlife crisis, when the person didn't know in which direction to change his life. So, about his life circumstances, he was divorced, but had a girlfriend in another state. His dilemma was that to move or not to move there with this girlfriend. But the biggest problem was that he was very, very jealous on this girlfriend, because she has there in that other state other two friends and also two mini pigs. And the problem of my patient was that he considered this girlfriend spent too much time with her other friends and with the mini pigs. So there were a lot of quarrel because of them. And he feels also cheated because he said that although he was always very correct, he did not receive the visa. So he cannot left the country. About his temperament, he said that he's nervous, tense, irritable, and he used to anger easily. And he used to drink daily to reduce his tense, and swears a lot. And here, when he said that he used to drink daily, this was this aspect why I have spoken before about these trips. My patient was, let's say, an easy patient, because he recognized that he used to drink daily, and he told me also the quantity. But not in all the times it is so easy, because they have this tendency to not recognize exactly how serious this problem is. So about his fears, he had fear not to lose his girlfriend. He had fear in the dark when alone. He had fear from height, and he had intense fear from snakes, and also fear from death. He cannot tolerate being criticized, being spoken what to do. He used to offend it easily, and he had a lot of problems at his workplace because of it. And he does not tolerate gossip. He is also very suspicious and very strict with himself, having many remorses. When he get angry, he become auto-aggressive. He used to cut her face when was disappointed in love, or beats his head against the wall. About his childhood, he said that his parents divorced, being raised by mother and grandparents, and they were very strict. He said that he never meet his father. He has got a toy once a year. And he was very, very affected about these things, that he has never meet his father. So the mother meant everything for him, and now he had many remorses after her death. He also presented sleeplessness, repeated dreams with fear of unsuccessful exams or aggression. He is sensitive on noise, but used to listen to loud rhythmic music. He likes fishing with friends. He don't like to be alone, but neither to be married. This was again a very peculiar and intense symptoms, and he repeated that although he didn't like to be alone, but neither the idea to be married is not suit to him. He likes cold weather, but is sensible on air draft. About his physical symptoms, he had a surgery on his left knee. He has this stiffness on left shoulder, has an irritable bowel syndrome when angry, cannot eat, had a bad odor from his mouth, variable thirst, and an increased libido and nicturia. So now if I analyze the case from the system approach point of view, we can see here that here we have these themes of me versus others. The others can be the girlfriend, the colleagues from his workplace. He is very aggressive and also auto-aggressive. He has this contradiction of will and intense jealousy. So this suggests that the remedy should belong to the animal kingdom. And also the other themes like feeling cheated, very suspicious, destructive, this interior antagonism, the intense fear of snakes, and he had also a tattoo on his body suggests that the remedy belongs to the reptile subclass. And now if I repertorize his symptoms, I take in consideration these ailments from being neglected by father, because this was a very intense symptom from his childhood. And this I find a very interesting rubric, because there are only 11 remedies. And as we can see, lachesis is one of the remedies. And it is very interesting because I treated many persons, different kind of pathologies with lachesis, and I can tell that in almost each of my patient, I find that they had somehow a not very happy childhood, or the way how they perceived their childhood, it was not a very happy childhood. I take another peculiar rubric, this alcoholist with complaints of upper limbs, because if you remember, his chief complaint was the pain in his left shoulder. Here are only 4 remedies, and again, lachesis is one of them. And of course, I took many other rubrics like destructiveness, fear of death, fear of snakes. And here we have another very typical rubric, the irresolution to marry. And here we have only 12 remedies. And again, lachesis is one of them. And it is another one that the idea of marriage seemed unendurable. And now, if we read from the Materia Medica about lachesis, from the reliable reverse repertory, we can read that the lachesis has this tendency to become addicted to alcohol. And from the Mirilli's thematic Materia Medica, we can read exactly that has fear of marriage, irresolution to marry, aversion to marry in woman, or they are usually doubtful and have this indecision, irresolution to marry. And the first control after 3 weeks shows that he feels much more calm. He don't need to drink alcohol. His sleep was better. The bad odor from mouse had gone. His appetite increased, and finally he took the decision concerning his life. And he remained here in Romania. The second case is a case of an old woman, 69-year-old, which again, she came to me because of another reason. But finally, I find that she was addicted to alcohol too. So her chief complaint was the suppurative varicose ulcer on left leg, which was resistant to allopathic treatment. And as an observational fact, when she entered in the clinic, she had this very bizarre clothing, a long, dirty black dress, and she was very intense makeup, and she had this a big black braid in her hair, somehow showing eccentric how she mourned. About her case history, and in this case, this was the root of her suffering, that 20 years before, her daughter, pregnant with the second child, died in a car accident, which was a big loss for her. So she had to raise her first granddaughter of 9-year-old at that time. She had never recovered from that pain of loss. She cried a lot, was sleeping in house surrounded with dogs. She could not communicate with anybody. And 5 years later, after the death of her daughter, the varicose ulcer developed on her both legs. So imagine this woman was living with this varicose ulcer since 15 years now. About her temperament, it was very interesting that after speaking about this big loss of her daughter, she immediately started to speak about that how much she missed those times before the tragedy, because she was a singer in a folkloric ensemble and used to sing at parties. So she had this desire for amusement very intensively, and she said that she missed very much those times. She played the key roles. Her nickname was Fucking Bitch. Speaks a lot about this aspect. She was very loquacious. She has a very specific loquacity, and all the time she has the tendency to speak about this chapter of her life. After that, she said that I'm a mad because she lives with 12 cats now in the house. But she said that before that, she lived also with 22 cats in the house. She likes jewelry, talks about herself in a very laudative manner. And she's very attached also to her family members and very materialistic. About how secretive she is, she said that nobody saw her leg, and in fact that is why she is wearing that long black dress. Not only that she is mourned, but also that she don't want to show her leg. And she cared for her mother many years, but for her this was a big drama, and that was the reason she said that she started to drink daily to can cope with her responsibility of diaper changing. And here it is also important to ask the members of the family if you have the possibility. In this case, I have the possibility because she came to me with her sister, and her sister confirmed that she used to drink since many years daily at home. Because sometimes, and it was also in her case too, that she didn't want to speak a lot about this problem related to alcohol consumption. She had fear from snakes and snails, fear from reptiles in general. She had very intense sleeplessness. And about her physical genitals, she had also heat flushes. She was operated by uterine fibroids many years ago, but nobody from her family knows about her illness. Imagine that not even her husband knows that she was operated because of this uterine fibroids. So after that, I find that she is warm-blooded. She has perspiration on the neck, and another keynote was that she does not tolerate anything around her neck. Now, if I repertorized her symptoms, taking in consideration her main symptoms like the ailments from grief, which in her case was the root of the problem, and also I take in consideration the desire for amusement, because this was a very intense symptom. Her specific loquacity, jumping from one subject to another, the ailments from alcoholism, and also the fear from snakes. And maybe I should take in consideration also her secretiveness. The remedy is lachesis again. And if I make the sectorial repertorization only based on her physical generals, I arrived to the same remedy, having this throat external clothing aggravate, the uterus, the myoma of the uterus, and also these single remedy rubrics related to the aspect of her ulcer. And now if I show to you the images, how her leg was at the first consultation, and just 5 weeks after the starting the treatment, as you can see, the evolution was very good, and till the end of September, her ulcer was healed. But what was very important from the addiction point of view was that she stopped drinking. So now if we read from the Materia Medica about lung disease, again from the reliable reverse repertory, we can read that lung disease has this ailments from dipsomania, can have this hereditary tendency to dipsomania. And another interesting rubric which lung disease have these ailments from that of a child. How exactly this remedy covered all her symptoms. And from the Fatak Materia Medica, we can read the skin that had exactly the same mottled or livid dark marks, ulcers, eating on legs with bluish purple areole, exactly how her legs look like. From the Murphy's Nature Materia Medica, we can read about lung disease that it is indicated in alcoholism. You can see here in alcoholism, in high blood pressure, in ulcers and varicose veins. So now I would like to speak a little bit about the other part, about the art therapy and how art therapy can help patients with different addictions. So as I said before, at the beginning, I worked in psychiatry many years, and in 2003, I was quite at the beginning of my career there. I was very touched about this, that patient with alcohol dependency, they were admitted in this hospital for chronic mental ill patients, and they received, of course, a lot of treatment, psychotropic drugs, because of their alcohol dependency. But the very sad part was that because they had nothing to do the whole day, they not only that they had having this alcohol dependency, but they became addicted to tobacco and to coffee too, because the whole day they were smoking and they were drinking coffee. And I didn't like at all this situation. So I was thinking, how could I help them? And I came to this idea that to help them, it would be very important to give them something to do, because I find that the most difficult situation is that when a person does not have anything to do. And in this way came this idea that it would be very important to initiate some occupational therapy for them. But of course, there were no money for this. But this is so beautiful that as Paulo Coelho had written, that the universe always helps us fight for our dreams, no matter how foolish they may be. Our dreams are our own, and only we can know the effort required to keep them alive. So this dream of mine was very alive, and the universe helped me, because shortly some German psychiatrists came and visited the hospital, and they give me some financial help, and we can start this activity. And this activity is functional even today, and I find that this help very much the patient with different dependencies. And why it is happening like this? And the answer you can find, or the answer which I give to you here, maybe you will find very, unusual, but this is the real cause why the art therapy help the patients with different addictions, because art and addictions are the two polarities of the Neptune archetype. And people who attended my webinar from 25 July, maybe there I have spoken more about this aspect. But the things are so that during an art activity, we reach the modified state of consciousness, but this is in a constructive way. And during different addictions, no matter which kind of addiction, which is common, that there is also a modified state of consciousness, but in this moment is in a destructive way. So through the art therapy, or I can say also astrotherapy, which is happening this vertical shifting of the symptoms. And that is why art therapy is so effective in these people. And this is exactly what we find out in all these years when I work there, that the art therapy has many, many benefits for these patients. Why? Because it allows the free expression of the emotions, anxiety, frustration, tension. I think that all of us, we know that the patients who has this tendency to addiction, they are not very good to communicate their emotions. Usually they are very shy, timid people. And so through art therapy, or the art therapy allows the nonverbal expression of ideas, and it helps them to bring to the surface images from their subconscious. And it was very beautiful how we can see how they evolve. For example, through many months after many months of treatment, how their painting look like at the first, and we can see their whole evolution through their artworks. So the art therapy help them to rediscover their own creativity. In many, many cases, we realized that they are very, very gifted, talented in painting, in music, and these were things which they didn't knew about themselves. So the art therapy is an artistic, symbolic self-expression. And another thing which was very important for this patient, that it gives the feeling of meaningful work. And through this, they can experience this sense of success. And imagine that we are speaking here about some people who became isolated because in most of the cases they were rejected by their families, they were rejected by the society, so they had no any sense of success nowhere. And through this art therapy work, finally they can have this sense of success. So through these little successes, it helped them to regain and strengthen their self-esteem. Of course, it is also very important, this aesthetic experience, because to work with different colors, with different materials, it in itself it was a wonderful aesthetic experience. And finally, so we can say that the art therapy is a self-discovery method and a curative act in a cathartic sense. And our work, or the work of the art therapist, it is beautiful because as Benjamin Disraeli had written, the greatest good you can do for another is not just share your riches, but to reveal to him his own. And this is exactly what has happened there. And another part was that because this activity has happened in a group, in an art therapy group, it was also a very important benefit, that the integration and the group membership, that finally they belong to somewhere. And in this way, the group was as a supportive environment. And in the same way, it was very important, there were very important the relationship in this group. It facilitated the communication between them. And in this hospital where I worked, it was also important that it had to structure their day, because if before this activity to be there, this patient, as I said, they did nothing the whole day. So these occupational therapy activities, these art therapy activities, help them to structure their day. Of course, it helped also the emotional maturation through accountability, because if you belong to a group, maybe you will have there some tasks or some little responsibilities. and through all these help them in their emotional maturation. Of course, help them also to increase the tolerance for frustration by developing self-control. This is another problem which this kind of patient had to deal with. As it was in my first patient that he lose very easy his self-control. So this group therapy helped them also in this way. So finally, we can say that it helped the personal development through individual transformation, and through this, it facilitates the reintegration into society, or prepare them for the reintegration into society. Uh, the result of the work from the art therapy department I presented in 2008 at the National Congress of Psychiatry in Bucharest, and later on in 2012 at another conference in Romania. And here I would like to say a few words about the different techniques of art therapy, or sociotherapies, how it is called. So there are the visual art techniques like drawing, painting, modeling, collage, the folk art techniques. I would like to say that that in that hospital, the patient had the possibility to practice both of these kind of visual art techniques. There are the auditory kinesthetic techniques like music therapy, active or passive form, which means active playing an instrument or singing, or passive just listening to the music. The dance, the therapeutic game, or puppet handling. There is the bibliotherapy, which means discussion on a read text or writing poems or journals or stories. And some of our patients also, they had the journal monthly where they used to write poems or stories. And there are also the resocialization activities like trips and zootherapy. And I would like to remind you that my second patient, this old lady, having so many cats around her, she somehow instinctively did this zootherapy. Okay, that there were too much cats, maybe, but still it was very important to help her in healing her soul because of her big loss. So here are some from the paintings did by our patients. And in conclusion, I would like to say that homeopathic treatment quick the process of healing from traumas, helps the individual to feel stronger emotionally, helps to restore the balance and harmony, facilitating the long-term improvement of physical and emotional health. And I would like also to remind that the reason why homeopathy can be really effective is that the remedy address the root or the cause which determine the different addiction. I mean, we go further, we go beyond, we go deeper in our anamnesis, and if the remedy cover also this kind of suffering, like in the first case which I presented was the ailments from being neglected by father, and in the second case was the ailments from grief, then the healing can be totally, I would say. Of course, not exactly totally, because in the alcohol addiction, the problem is okay, she stopped drinking, but what happened after that? A month later, there were the wedding of her granddaughter, and at every wedding, there were a lot of alcohol, and then she restarted to drink. So that is why the role of the support group is also very important, and homeopathy can be combined with any psychotherapy or support group. And I would like here to emphasize that the role of support group can be, and it is very important to maintain the recovering, to strengthen the patient to resist to the temptation to drink again. So I would like to finish with this beautiful quote from Gary Chapman, where he had written that my own definition of success is leaving your corner of the world better than you found it. So this is what I try to do in that hospital. And yes, I am very proud of this, that what I initiated in 2003, it is continuing even now, helping many patients from that hospital and created even new workplaces. So I think that, yes, it was a good idea. And here you have my references, and thank you very much for listening me. Thank you.
Good evening. That was a wonderful session. Wonderful session. I never knew art could be, therapeutic. And definitely, art, music, all forms of art is therapeutic.
Yeah, thank you.
That's such a lovely presentation. Shall we go on for a question and answer session?
Yes, of course. Yes.
That's lovely. If anyone has any questions, anyone wants to note her email ID for further references, please note. I'll give you a few seconds to note it, and then we'll go on for a question and answer session.
Thank you.
Yeah. That's such a lovely. Does anyone have any questions to ask?
Oh, no problem. I can ask as many as they. No problem.
Yes. People are typing, so I was just letting them, pull the whole seminar into the webinar, like sink into their heads, and then they'll be like typing questions. So it'll take a few seconds. What sort of
Oh.
The first question: what sort of potencies do you use for these cases?
Yes. In first case, I gave 1M, Lachesis 1M, and in second case, I started with Lachesis 30 because I was a little bit cautious not to cause aggravation, and after that she followed with LM potencies daily, LM3, LM4. And I think it was a good idea because she had pain at the level of the ulcer. The pain intensified after starting the remedy. And that's why after that I followed with LM potencies. And for the varicose ulcer, locally we used also calendula mother tincture diluted in water.
There's another query. I would like to suggest Dr. another webinar about all kinds of addictions as well. Yes, that would be lovely. I mean, it's even this day and age, even social media is become an addiction.
Yes.
People cannot keep down their phones, or they need to constantly keep there's an itch, they say. That's the common word there, the itch, that I need to go and check my social media every few seconds. So that has become a huge addiction this day and age. Alcoholism or other substances has taken a back seat, and now this has come in front.
Yes, I understand. And it is very interesting that these people, especially now, I am speaking about Lachesis because both of cases were Lachesis, and because I treated many patients with Lachesis, I find this feature of them that in every situation they try to control the situation, but they cannot control themselves. They try to control everything around them, but they are not good in control themselves. So when it comes about them, they lose control. Like it was in the first case that he became even auto-aggressive. It was very impressed.
Very true, very true. I think someone's typing another question. But have you had cases of addictions other than alcoholism?
Well, yes, now I remember that I treated, but the remedy was again lacrisis. I had a very interesting case. He was not addicted to alcohol, but he has this, how to say, addicted to his partner, Yeah,
That's interesting.
addicted to his partner, but he was even aggressive with her. Yes, that was a very interesting case. Maybe I should present in one
Oh, okay.
because it was so challenging. Wow. Yes, maybe I will present in one moment.
Do you feel that the abusive nature or the destructive nature comes along with consuming the substance, or is it just the individual who is suppressed with all the emotions just comes out
Hmm.
as
I think, as I presented at the beginning, that there are these two motivation, if can I say so, that uh, a few of, there are few young people who became addicted just because they have this desire for pleasure, that they want to try this or that, and very quickly they became addicted. For example, in that hospital where I worked, we treated there were also patients addicted to different drugs, and we had not only alcohol addicted patients, we had also drug addiction, and of course tobacco addiction, and
okay.
many so for these young people, it is like this, that they feel bored, and then they try this and that, and very very quickly they become addicted. But there is also, and this is, I think that it is most frequent, that people use the alcohol or the other things because of their suffering, because of their pain, like it happened, for example, in both of my cases. Because, for example, in this first case, his sensation of isolation, of he couldn't find the way in his life what to do, to marry this woman, not to marry. He was already divorced from his first wife, so it was a very complicated life situation. So and he was somehow aware that he used to drink daily to forget what is happening with him. And in the second case, of course, it was that very big suffering because of the loss of her daughter. And of course, it was huge, imagine, to live with this. So what she have done, uh, okay, I don't want to enter in this astrological part, but because I am really interested, this gave the most deepest answer on this situation, because a big loss like this is related to anahata chakra, if I say so,
Uh-huh.
because it has to be with love, no, and the love
Yeah.
is belong to anahata chakra. And what is happening?
Separation.
Yes, and what is happening? This big grief, it is the other polarity of the love. No, it is the love and the grief, which belongs to the Anahata chakra. And in astrotherapy, what I said, we have this possibility of vertical shifting of symptoms, and which means that according to the law of analogy, she or in psychology it is said sublimation. You sublimate, but what the problem is that she sublimated in a destructive way, because alcoholism is a destructive way. The alcohol belonged to the Neptune archetype, and Neptune belonged also to the Anahata chakra, because Anahata chakra is ruled by Venus and by Neptune.
Neptune.
Neptunus is the divine love, the highest love, and but the alcohol belong also to Neptune,
Okay.
only in a destructive way. And the love for the cats it is also a vertical shifting of symptoms because it is also about love for the
Yes.
animals. And in fact, this helped her. I mean, this love for animal, it was very good for her. It was like a zootherapy, really. Okay, this is another part that she having
Oh,
22. It was too much in a house. But anyway, it helped her a lot. So if I have to analyze this thing that she had so many cats in a house, this was really a good thing for her. It was another part that it was too much in a point. But the alcohol problem, it was a destructive way. But both of them belong to the Anahata chakra. So,
I see.
and that is why. Uh, Finally I find the answers in this astrotherapy because okay, we can analyze the things from psychological point of view, from different, but the deepest explanation is in this. If you understand the chakras, the archetypes,
Yes.
the, you know, why it is happening like this, because there were a love for her daughter, which and she had to deal with this big grief, and somehow she had to um, how to say to so she couldn't went through this
Overcome or yeah.
to overcome this situation. And this was the most beautiful part of the homeopathy is this, that it can cover, like I presented, one remedy every single aspect, because the Lachesis have this ailments from grief, the Lachesis have the problem related to alcohol, has this aspect of the ulcer, and practically covered everything. And that is why and how it helped her so quickly. But as I said, I agree that a support group is also very important, because after she um, resolved this problem with she went off from the alcohol, it would be very, very important to have a support group uh,
Yes.
to can have love from somehow, somewhere, because
Very
okay,
true.
she had a husband, but God knows. Most probably her husband was very suffering too. I never met her husband, so I don't know what was there.
It usually takes an individual to have a coping mechanism from the outside
Yes,
perspective, as a doctor, as a professional, more than a family member. That would have been more helpful than a family member coming into the situation. It would have been more of a problem for her. We have a question.
yeah. For
Okay.
marijuana addiction, I don't know. You can try to find in the reliable repertory from the Synergy homeopathic software. There are many rubrics, and maybe I can. I don't know all the rubrics, but if you make a search, probably you will find something there.
Definitely. So, you feel that every individual, the process is like every individual who walks in the clinic would have to go through the case taking, the history taking part, and they have to give us the mental symptoms, and we take a proper repertorization of all the
Yes.
symptoms, and then we could the classical method of
Yes,
homeopathy.
it is the classical.
Yes,
That is
that
why
is
practically, you know that the situations are different, but I think that homeopathy is one. And I mean, we have to follow the homeopathic approach.
individualization.
Yes, the individualization and the holism, no matter that what is the problem.
Very
And of
true.
course, it is very important to take. I try to do in this way, to take the case deeply, as deep as we can, taking in consideration even the childhood and every kind of traumas, because as you can see in this first case, he was coming for this
Father.
pain of left shoulder. And of course, maybe finally, if I would make only a sectorial repertorization on the pain of the left shoulder, maybe I would arrive to the same remedy. I'm not sure. But I think that through case taking, when we take the cases very deep, we can help the patients too, uh, because of their they became aware of their problems. So somehow it is like a psychotherapy session, that you I put them to speak about themselves, and this helped them to recognize.
Let out, yeah, vent it out, or let the
Yes, exactly.
free speaking is what we call it.
Exactly.
Yeah.
Exactly.
So I was actually, that was my next question. So, is this the history? That was actually the question of this history taking. Is it like involved, since you're a psychotherapist? Does it, like, do you combine both and do it, or is it two separate sessions?
No, I do it at the first. I do it everything in the same time. Um, at the first consultation, sometimes yes, sometimes it is difficult for me to make the repertorization very quickly, because if the history is very long,
Yes.
then I tell to patient that I will give you the remedy only tomorrow. I need a time or
Time to, yeah,
yes.
that's
I've had
necessary.
situation like this, but yes, I usually let them to speak, and I try to find out the things from each and every area, and especially regarding this addiction problem is very important, because I don't know if it was obvious or not from my cases, but none of my case had coming to say to me that they have problem with alcohol addiction. I find out only because I make I big I I went very deep, with the
Very true.
anamnesis. And even so, for example, this second patient, because because of the nature of the remedy, lachesis is a very secretive remedy, as we know. And then they are very loquacious, and they have this tendency to speak and jump from one subject and the other, but they avoid. They have also the tendency to avoid the she
Conversation. That is why they keep jumping from one
yes,
conversation
yes,
to other,
yes,
so that they can
yes.
avoid.
She kept speaking to me about this part of her life when she was a singer, which didn't interest me so much. But so it was quite difficult to bring back again and again that let's speak about, Okay, no, I don't used to interrupt frequently, but. Yes, which I want to emphasize that with this kind of loquacity patients, sometimes the case taking, it's a big challenge.
Yes, yes. So to keep it in one direction, it is very difficult.
Yes, yes,
You should pull them to the same direction all the time. You keep pulling them
yeah.
back. Oh, lovely.
Yeah,
Wonderful.
somebody is writing here that I deal with many adolescents addicted to marijuana. I would be very curious. Please share with us.
Yes, yes, yes.
Can you unmute?
Yes, yes, sure. I will definitely give her the access. 1 second. Uh, okay, there's one more question. I will till the time she confirms the access, I will just publish this question. Do you use only art-based therapy, or in Laurel behavior therapy, or person-centered approach?
Uh, uh, Art therapy I don't use in my practice. So I initiated or organized this art therapy there in that hospital where I work. I don't work there anymore because since 2 years I quit from there, and now I am doing only homeopathy. But yes, when I see that the patient would need this kind of therapy, that I can advise the patient that please go and find an art therapy group to you or things like that. Um, but I personally I cannot do the both in my practice.
I have given access to Dr.
And
Cynthia.
about
I would
about the excuse me, about
yes.
the other part of the question, behavior therapy, or which helped me maybe in case taking, is that I have been trained in family therapy, so I did 3 years of training in family therapy, and yes, this helped me to maybe to see better this family dynamic, and how to put questions or how to not put questions, just let to speak and things like that. But now when I make my consultation as a homeopath, then I do only homeopathy. But somehow, of course, that all what I have learned in so many years helped me to understand better the patient, maybe.
Experience speaks, definitely.
Yeah.
I have given access to Dr. Cynthia if she can unmute her mic and camera, and she could share us her experience on. Yes.
Do you what?
Hello.
Hello, Cynthia. Nice to see you. Thank you for.
Uh,
I cannot hear you.
we cannot hear you.
Please unmute yourself.
Uh, it's actually unmuted.
Hello, Cynthia.
Are we audible to you?
Can you hear us?
Uh, no, I've given the permission for her to. There's no technical issue from my side. Can you hear us? Okay, she can hear. Okay, we
Okay,
are
then.
audible. Yes. Try speaking. Yes, we can hear you. Great. Oh no, 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 no.
Tanya had written that she cannot talk. Dr. Rashmika, can you unmute Tanya, maybe?
Yes, sure. One
Tanya
second.
Fonseca.
Just a second.
Hmm.
I'm not able to find the right button. I can see and listen to you, but I cannot talk.
Wow.
Tanya, I'm sorry you cannot talk because I have not given you the access. Uh, do you want me to give access to Tanya? So Tanya, do you have a case to share with us? Okay. Great. I hope we'll have further conversations with you, Tanya. Thank you so much. I hope we have further interactions and conversations and case discussions with you when you have.
Okay. So you
Uh,
can.
have you tried? Is there any problem with the earphones? The the speaker, the microphone of the earphone. Do you feel that could be an issue? Try disconnecting it and try talking to us. No, 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 no. You can try disconnecting the earphone.
Okay.
Okay.
I have time. I can wait. No problem for me.
No.
No. Sorry. I
I
feel
really
so
hope we could.
sorry.
I really hope we could have the.
She said she is writing that it is unmuted.
It is unmuted, but you. But we can't hear. There could be some problem with the
The microphone.
technical side. Yes, technical side. Yeah, from her
Mhm,
side. I
mhm.
really hope we could hear you. Okay, I would personally contact you. We will definitely have a chat about it.
Yes. Anyway,
For
thank
sure.
you very much, Cynthia and Tanya. You
Thank
are
you very
so
much.
wonderful friends
Yes,
from Brazil.
we we
Thank
would
you.
definitely get back to you. We will definitely have
Thank you very much.
a session with you also. Cynthia, if you could type your email ID, I would love to contact you. We could have this chat.
Yes, but can you put my email ID there? How can I
Yes,
type here?
yes. You want me to type your email ID?
Yes, I type. I am typing now.
Okay, sure. You can type it in the card. This thing I will publish it.
It is Alice.
Yes,
Yeah, it is okay.
yes. I will publish it. This is her email ID. Please do contact her.
Okay, thank you.
Yes,
It's
it
okay.
was a wonderful session indeed. Dr. Ranganathan, could I please get your email address? Yes, definitely, Sarah. Definitely. I would just type my email ID as well. Dr. Cynthia, even you could share your email ID so that we could personally contact you. This is my email ID. Any queries, anything regarding the webinars or post webinars, you could please contact me. Definitely. Edil, your one second.
Yes.
Uh, yeah, sorry. Adele has forwarded a question to me saying she wanted to purchase a book. I would definitely let her know regarding the details. I don't have the exact information about it. I would definitely get into the issue. I will search. I will ask the query, and I'll get back to you. If you can also mail me regarding the same, I would get back to you as soon as possible. Thank you. Any other questions and queries? Or can we end the session with this lovely note? Yes. Thank you so much.
Thank you very much, Dr.
Thank you
Rashmita.
so much. It's been a lovely, lovely session. I hope we have more sessions like these. I
Okay.
would love to learn more about the art therapy and the astrotherapy. It
Yes,
will be
maybe.
really a pleasure.
So I would like to ask you again if to send to me the registration
Yes.
also from the last week,
Yes.
okay? And
Yes.
this one too, if you
Yes.
can.
100%. I would personally email it to you. Yes.
Thank you very much again.
Thank you so much. Thank you so much. The webinars would be uploaded. The recording of all the webinars would be uploaded on the I Love Homeopathy site. The previous webinars, already present webinars, you can access through www.ilovehomeopathy.com/webinars. I will publish it so that you can access it, and you can visit the website for the previous webinars. I would be publishing the webinars for the past 2-3 days. All the webinars of the 2-3 days in a short while. You can access them also through the same website. Thank you so much. keep supporting us and keep visiting the webinars. Thank you so much, Erzsebet. It's
So
been a
thank you
pleasure
for the
meeting you.
possibility and for your
It
help.
has been a pleasure meeting you.
Okay.
Thank you so much. Have a good evening.
Many thanks. The same. Bye.
Bye.
Bye. Bye for everybody.
Bye. Thank you. Thank you so much.